All right, taking a live look inside of the State House right now. State officials are giving an update on the coronavirus in Massachusetts. Let's listen in.
Mitigating the coronavirus outbreak, and we are preparing for more confirmed cases to occur. Our state and local health officials are monitoring this issue around the clock and working hard to provide additional resources and support to our residents. I know the closures and disruptions are unsettling, but I actually think seeing all of these changes means people are coming together to push back on this disease. We're all going to miss watching the Celtics and the Bruins for a while, but what that means, I think, is that people are acting not in their own self-interest, but acting to help one another. And one more thing, there is no shortage of food or dry goods at our stores. Some shelves in some stores have been bare. We've all seen the pictures, but guess what? They weren't bare the next morning. I ask everyone to please use their heads, get a few extra items when you go out. Perfectly appropriate. But filling your basement with 2 years' worth of canned soup just means your neighbor will have to go without. For responsible planning advice, you can always visit mass.gov/no-plan-prepare. I want to take a minute to go over what the science tells us once again about this disease. For the vast majority of people, approximately 80% of the population, COVID-19 would mostly feel like the flu. The infection would not lead to hospitalization, and your body would fight the infection and recover. But the reason we're taking this so seriously is because it is incredibly contagious, much more contagious than the flu, and it is especially dangerous for people with certain pre-existing conditions and for senior citizens. Our administration is working with the federal government to analyze the facts, use the guidance of the World Health Organization, our public health officials, the CDC, and our world-class hospitals. We anticipate there will be more cases of COVID-19, but we also know if everyone plays their part in slowing the spread, our healthcare system can be better positioned to care for the people who need it. Wash your hands, avoid crowds, cover your cough, and pay attention to the medical guidance. That is how we push back on this disease and make sure that the number of people who contract it remains manageable. But we truly are all in this together, and if we act now to practice good hygiene, keep surfaces clean, engage in social distancing, and do the common sense things that we've all been talking about for the last few weeks, we can make a difference. Now, Lieutenant Governor Polito and I are joined here today by the entire cabinet because responding to this disease is going to involve just about every corner of state government. We're also going to continue to meet the needs of our residents and, of course, continue to operate state government. But I do want you to know that starting now, we're standing up a coronavirus command center. It will be headed up on a full-time basis by HHS Secretary Mary Lou Sudders. This team of experts will focus solely on pushing back against this disease and on expanding testing capacity and distribution and quickly responding to the needs of our communities. Expert teams will work to expand lab capacity for testing, plan quarantine operations, coordinate communication and guidance across government, respond to the needs of our local boards of health, monitor supply chains, and identify surge capacity in our healthcare network. The command center will be made up of representatives from the Department of Public Health, the Emergency Management Center, Department of Labor, Transportation, the MBTA, Massport, multiple education agencies, and our public safety agencies. The command center will have complete authority and discretion to tap whatever state funds are necessary, and this includes, of course, the $15 million that was recently appropriated by the legislature specifically to battle COVID-19. The command center will be the Commonwealth's single point of strategic decision-making and coordination for the COVID-19 response across state government. By convening decision-makers from these facets of state government, our administration will be able to continue to ramp up our dedicated response to this developing and evolving situation. We believe this is a primary and important step in our planning and preparedness and will be a strong complement to the work that's been underway for weeks across state government to keep people safe and healthy. Setting up this dedicated team will also ensure that state government can continue to run on a reasonably uninterrupted basis to meet the needs of those who rely on us every single day. And I know I speak for the Cabinet when I say that most days the hard work of so many state and local workers goes unnoticed. And it's in times like these when we must pull together that the sacrifice and dedication of all of our state and local workers is on full display. One final note, I want to remind everyone that in addition to the role we all have to play in pushing back against the virus, there are other things we can do. Call your neighbors, your friends, and your family members. A friendly check-in can go a long way right now in helping somebody through their day. As a reminder, you can always visit mass.gov/COVID-19 or call 211 for the latest information, and visit mass.gov/know, plan, and prepare for helpful advice on planning for emergencies. With that said, I want to turn the podium over to Secretary Sudders, who will talk a bit about the Command Center and some other updates.
Good morning. Thank you, Governor, Lieutenant Governor, and my colleagues in the Cabinet. As you heard from the Governor, I will be leading the Governor's Coronavirus Command Center. I will be handing over my day-to-day responsibilities to Dan Tsai, my Assistant Secretary at Health and Human Services and who is also our Medicaid Director. I leave them in very capable hands so that I can devote full time to this responsibility. Coming out of the gates, our priorities will include expanding the capacity and distribution of testing, the allocation of personal protective equipment, surge hospital crisis capacity, scenario modeling, and contingency planning and supply chain vulnerabilities. And the work actually started over this weekend. As we transition, I want to speak for a few minutes about testing, because I know that's on everyone's mind. As we transition into community mitigation, several important changes were made to the Department of Public Health clinical testing protocols to speed up and increase testing at our state lab. The first change is that clinicians no longer need to receive testing approval from the state lab prior to submitting specimens for patients that meet particular criteria. They include symptomatic healthcare workers and emergency medical services personnel who have worked while symptomatic, hospitalized patients suspected of having COVID-19 infection, individuals who have had close contact with someone with confirmed COVID-19 while symptomatic, who were present in congregate settings, clusters of acute respiratory illness in a congregate setting, household members with close contact with someone confirmed with COVID-19 and symptomatic, and those with symptoms linked to recent travel to high-risk countries. The second change is that clinicians can submit a single swab rather than the previous 2 swabs. That will speed up the testing capability at our state lab. As clinicians change their practice and follow the new guidances, this change will allow us to test more individuals in a day. As the Governor stated on Thursday, the Department of Public Health continues to request and receive new test kits, but we also know we need more labs to come online. Thursday, we received news that 2 commercial labs, LabCorp and Quest Diagnostics, received federal approval for testing. And this morning we heard a 3rd commercial lab has received federal FDA approval. Clinicians will be able to send specimens directly to the labs, and all results will be communicated to the state lab when completed. Remember, commercial labs do not use the CDC test kits. They have their own tests approved by the FDA. As we have repeatedly said, it is critical that more labs be approved by the federal government and come online in Massachusetts, and we continue to urge the FDA and CDC to help us expand our testing capacity so that we can test more residents across the Commonwealth. Beginning next week, as I have stated, the Department of Public Health will formally post testing data about how many individuals we have tested online every Wednesday at noontime. This coincides with our weekly updates on self-quarantine monitoring data. As of this Friday, the lab has tested 475 patients. I'd also like to just mention a few changes we have made in MassHealth. And as you all know, MassHealth is the public insurance program for about 1.8 million people in our state. Yesterday, under my direction, MassHealth issued new guidance that includes the expansion of telehealth and telephonic coverage. Physicians and clinicians can call their patients for care, and we will cover the cost. This is unprecedented. Usually, telehealth requires video conferencing. This is telephone. We're allowing 90-day prescriptions and early refills for everyone on MassHealth coverage. We are expanding hospital presumptive eligibility for anyone suspected by a provider for COVID-19. If they meet verbally the MassHealth income standard, they will be automatically enrolled in MassHealth, and we will do the paperwork after the fact. We have relaxed our contractual care coordination requirements and directed providers who have face-to-face activities, such as assessment of clinical need and member engagement, that they can do that work telephonically instead of in person. As you know, yesterday we announced 211 was officially up and running in English, Spanish, and available in many other languages to help answer the public's questions about COVID-19. As of this morning, first of all, thank you for getting the word out. As of this morning, 760 calls have been answered, with a marked increase in the hour after yesterday's press conference. Call topics are wide-ranging, but primarily focus on testing, access to supplies like hand sanitizer, and workplace questions. So with that, I will turn it back over to the Governor. And thank you for the confidence, Governor.
Questions?
You mentioned that about 500 people so far have been tested. Does the administration have any sense right now of how many people are waiting to get tested?
I think the way to determine that is more a function of what follows with the process with the clinicians themselves. I don't know if we would know the answer to that, because it goes from the clinician to the lab and then eventually gets processed and sent back. But those come in all day, every day. So they're always in process with respect to that. But I do think changing the criteria, as the CDC has broadened the criteria, and the Secretary ran through a pretty significant expansion of who's eligible for tests, and the coming online of the corporate labs as well as the state labs' ability to process more tests will mean that far more people are going to get tested over the course of the next several weeks.
You previously had said you hope to get 400 people, and 400 get tested starting next week. With this expansion, any estimate on what number that could rise to potentially?
Yeah, I wouldn't speculate on that. I will, yeah. I'll tell you what, ask us that question at the end of next week, by which time we'll have some real-time experience with it.
Can you break down when these people have been tested? Were they tested mostly this week, within the past 2 weeks?
So that is the...
You got to come.
Sorry, my apologies.
Yeah.
So that is the number to date since our state lab was approved for testing.
Governor, superintendents have closed schools, but how have you recommended that schools close?
Yeah, look, this is a difficult issue, and it's one that if you just look around the country, different states and different communities are pursuing different strategies based on the best available data and the guidance and the advice that they're getting. Our advice and the guidance that we issued from the Department of Public Health was that if a school has an individual or a parent who is symptomatic and tests positive, then they should close for 2 weeks, a school. But if they don't have anybody who's tested positive or is symptomatic, then they should continue to go to school. And that's been the guidance that we've put out, and many school districts in Massachusetts adopted that guidance, and others went in a different direction. And that's exactly what's playing out in many states across the country. And I do think it's important to remember that this all comes with the phrase, "at this time." People are making decisions based on the guidance they get from the experts and the best available information they have at this time. And as we've said since this whole thing started several weeks ago, it's an evolving issue, and as the issue evolves and as the facts change, decisions change, and that's what I expect will continue to be the case.
And also, Attorney General Morris Healy has suggested that testing is not, I guess, happening fast enough. What would you say to that?
Oh, we've said for the past several weeks that we are deeply concerned about the lack of a response from Washington to make it possible for states like ours to dramatically expand our testing criteria and our testing capacity. The recent changes from the CDC with respect to testing criteria, which we just implemented, and the availability now of other labs, including LabCorp and Quest, to be able to test, will dramatically increase our ability to test, and that's a really good thing. So I think in some respects, we have a long way to go on this, but the feds do seem to be getting much better at providing a path for states like ours to test a lot more people, which we think is good.
With more testing, do you think drive-through testing will become a possibility here?
You know, I've talked to governors in states that have drive-through testing, and remember, when you're talking about drive-through testing, it's not the actual execution of the follow-through on the test. It's literally the swab. And honestly, I got kind of a mixed response when I talked to them about drive-through versus just doing it straight when somebody's in the office or at the hospital. It's certainly something we're going to bake into the process. What we really want to do is make sure that we have the ability to test people who need to be tested. And whether it's as a drive-through or whether it's in an office or whether it's in a clinic or whether it's in a hospital, the key here is to make sure we test more people.
Governor, spinning off the question about school closures, can the MBTA maintain full service, especially as employees are affected by child care issues and school sick leave?
One of the things, obviously, that we're going to be dealing with, not just as an employer, not just as state government as an employer, but I think all employers are going to be dealing with, is what's going to be the issue and the process for dealing with staffing going forward. And that's obviously something that we're talking among ourselves and talking to the unions about.
Governor, this number of 475 people tested so far might come as a surprise, since a couple of days ago we were hearing that you were testing 200 people a day.
Had the capacity to test 200 people a day.
Why were some, if you had greater capacity, why weren't you using all 200 capacity?
The narrowness of those guidelines. I mean, the guidelines we were using, which were recommended by CDC, were such that if in fact you got tested based on those guidelines, it was highly likely that you probably had it. And that in fact turned out to be the case, because basically 1 in 4 of the people that got tested tested affirmatively. I do think one of the things that will happen with the broader guidance and the broader criteria and more testing is we will probably have less people as a percent turn out to be positive, but I think it's important that we test a lot more people.
I know those guidelines include 8 categories. They're kind of complicated. But can you just give us a little bit of an example of
Yeah.
who's tested now that could not be tested yesterday or the day before?
Sure. And the other change is the fact that you don't have to have the back and forth with our epi line, right? So, so a clinician, if they had one of the categories, and I'll give you an example, in the prior to the change, if you had someone in your office and you wanted them tested, you would actually, as the clinician, have to have a telephone consult with one of our epidemiologists, who would then, we would have to agree to then you send in the test. And we definitely heard that that was creating challenges for clinicians. So on the categories that I listed, and I'll give you an example, you don't have to have that conversation. The clinician makes the determination and you send in the specimen. So that is, I think, significant for the clinicians who are on the front line. So in the past, you had to be symptomatic, and you had to, if you came back from Italy, I don't mean to pick on Italy, but if you came back from Italy and you were symptomatic and you were hospitalized, you qualified. That is really how narrow it was. So you had to be symptomatic, it had to be linked to like travel, for example, or that I had come in contact, I literally had come in contact with someone with COVID-19 and was symptomatic and I was in the hospital. That's really how narrow it was. And so this is This is far more expansive. And again, clinicians, if they go through that criteria, and yes, it's written for clinicians, not for you and me, but clinicians know, so they will be able to take the specimen, one swab, and send it in to the lab. It really is a significant improvement, and we're going to be measuring to see how this works, because we want to hear, is it continue to cause difficulties for clinicians who are on the front line.
That one swab, is that why you can now double from 200 to 400 capacity instead of using 2 swabs?
So the one swab was a CDC change. The capacity change we mentioned is we're continuing to automate functions within the state lab. If you
Sorry. Can you also just expand a little bit on this command center, how it's supposed to work, and then the quarantine observation part of it, and the final part I'll just ask is, I know there's hospital groups that are quite nervous, people in the medical community, why this is going to make a huge difference.
So we will be having, so we are literally creating a command center. It will be located down at the Department of Public Health, so I'm actually leaving 1 Ashburton on the 11th floor. We have engaged a company who actually is extraordinarily capable at standing up PMOs, program management offices, with data analytics and the like. My chief of staff is coming with me, and we are pulling some individuals who've worked in state government to come back. They're being loaned back to us, as well as most of the folks behind me have appointed someone who is going to be their decision maker. So what will happen is an issue will come up related to COVID-19, and it comes up to the command center, and we will decide, nope, this cabinet will take it on, or it's something that crosses multiple agencies. It could be anything from, as the governor says, whether things change around schools, to workforce or the like. But what we're going to really be focused in the very beginning are the things that we know are pressure points right now. Testing. How do we expand testing across the Commonwealth of Massachusetts, including the issues that someone raised? Do you do sort of the drive-by testing, right? So we're going to do like a whole, what does that need to look like? What are our supply chain vulnerabilities? Disinfectants, masks, and the like. So literally, like, run through it. But you have to run through it in a very nimble, urgent way. Personal protective equipment. We got 10% of what we requested from the national stockpile, right? Who do you triage? Who gets it first? So it's that kind of very quick, nimble decision making. And as the governor said, I have the authority to basically ask him what it is, what resources I need in order to effectuate it. So it is it's a small command center to really actualize the issues that are on the ground.
How many people are in the hospital right now?
Can I elaborate on that for just a minute? Right now, you have 10 cabinet secretaries behind me, right? If they have an issue that's related to COVID-19, they're processing that through whatever other part of state government they think it needs to get processed through. Now, if it's a local issue, open meeting law. We spent a bunch of time trying to help communities deal with open meeting law, given the current situation with respect to social distancing. Big issue, big problem, right? Affects practically everybody here. But there's no place that you would necessarily say that's where that issue goes. At this point, anything that comes into these folks, or anything that comes on their radar that's related to something that has to do with this particular issue, it's going through their person straight to this command center, where that command center will process it and make recommendations or act on what they think is the right thing to do. And because these guys and gals are going to be full-time on this issue, they're not going to be distracted by whatever else was going on in the rest of their day job. And some of these folks have pretty heavy day jobs. And I think that's really what we want to do here. And then that will make it possible for us to start talking to people about, well, help us think about the things that we need to be worrying about next week or the week after. You mentioned hospital capacity. It's not an issue today, but it's absolutely something we believe the command center is going to take on as a fundamental assignment to figure out what the issues are with respect to hospital capacity going forward. I mean, I think on something this big, this complicated, spread across sort of all parts of society at this point, you need to have a central locus that can just focus on this. And that's what the point of this is.
Thanks, everybody.
Where will it be located, Governor?
DPH. Yeah.
Will there will access be restricted to it? Will people coming and going every day? Will they all live at the command center or be tested every time they show up? How we guarantee the command center remains healthy and functioning?
I think we are all doing the best we can to abide by what I would call the hygiene issues I talked about before. I don't think we're going to be, we haven't decided, for example, that we're going to be taking people's temperatures when they show up, but we are certainly expecting people to act on the same way and in the same behavior that we're proposing for everybody else.
Thank you.
Thanks, guys. Say again?
The shortages of personal protective equipment, where are you seeing those and where are the important parts of the
So right now, across the Commonwealth, through our regional public health coordinating organizations, everyone's on sort of conservation, and the 73,000 pieces of personal protective equipment we got the other night, a first batch went up to Berkshire because we knew Berkshire Medical Center had like several days' supplies left. And one of the first things that we will do is literally categorize where the highest need is and for the allocation. So that won't be like a random distribution, but a very focused distribution. And to answer your question, there's 10 individuals who are hospitalized who are presumptive positive.
What do you think about
Thanks,
the
everybody. You gotta get going.
hospitalization in one facility?
It's one of the things I've asked you to talk about.
Also, hospitals have said that the state can waive requirements for placing hospital beds. Does the state plan to do that?
Perfect example of what the command center, in fact, I have that written down on a board upstairs. That's exactly one of the things the command center needs to take a look at. Yeah.
Thank you.
Thanks, guys.
Is non-essential state employees and whether they should come to work. We printed out some messages to people. When school's closed, they're bringing their kids in. What is your guidance to them at this point?
Well, certainly that's going to be something that has to be dealt with at several levels. As I said earlier, we had a meeting last night to talk about a conversation we need to have with our public unions around work rules and strategies for dealing with both working in the office and working from home. I expect that conversation with many of the leaders and representatives in labor will take place over the course of this weekend, and hopefully we'll reach some kind of a framework for dealing with this come Monday. But the other thing you got to remember here is a lot of stuff people in public service do, you can't really do from home or do remotely. I mean, you can't run a public transportation system, for example, from home. You can't manage parks and other natural resources from home. It's very hard to do construction work from home. I mean, there's a lot of stuff that goes on around here that's going to require people to continue to be able to show up. And I think one of the things that's going to be incumbent on us to do is create a framework for dealing with this issue, which is what we've been talking among ourselves and to some of the folks who represent our employees. And I fully expect we'll be moving forward on a plan with regard to that sometime next week. Thanks, everybody.